All right. Hey, welcome to my series of 10-minute learning with Brandon. I'm Brandon, and we're going to learn a little bit about and understanding what NRP is, Neonatal Resuscitation Program, and how it's beneficial. So whether you're a seasoned healthcare professional or just starting out, this video will kind of help provide some valuable insights into ensuring the best outcomes for neonates in need of resuscitation. Now, the first little bit, I am going to talk about some journals. And this one in particular, I felt like was pretty important. It comes from the Journal of Multidisciplinary Healthcare. Just kind of let you know, I'll try to put all these links in the descriptions and everything after I get done, so you can go and read the whole paper, and I would really highly encourage you to do that so that you can get the whole picture. So this information from medical papers, medical journals, they're usually an evidence-based type of medicine, and it's the best kind of medicine. You do need to look at all the information that you're getting pretty objectively. As a person, you might want to make sure that you get the right info. It's just like the whole thing with the internet, you know. Even the things that I'm trying to bring up, it's definitely my opinion on a lot of these things. I'm trying to pull in best practices and things like that. But you should do some research and to let your mind kind of feel good about the information that you're getting and all that kind of stuff. So I encourage you to take responsibility and be able to find a lot of this information. And if you can find it in multiple places, multiple areas, then it's probably going to be pretty good. So just to kind of FYI, some scientific studies, they can, and like anything, can be manipulated one way or another. So it's depending on who's funding the project or funding the survey, all those different things that we're trying to find out with these different papers. It kind of makes a difference who's the big funding person and if they want things to be brought up or not. So kind of look at it like that. And then you just want to make sure you're doing the research on kind of asking these questions of like, who's doing the research, when are they doing it, where are they doing it, why are they doing it, and just kind of that. So just a little bit of, I know it's easier said than done, but common sense of, well, if this huge pharmaceutical company is doing the science-based research on it, is it really a good data that we're receiving and good information that we're getting? So this excerpt that I wanted to read here, it says the results of the interventions made in the first few minutes of life directly affect the quality of the life, creating effects that will last a lifetime. Intervention of the newborn in the delivery room in the first few minutes is extremely important. And we all probably have met some people that have, not had the best of care, and it just ended up not going real well for them. So intervention in the newborn in the delivery room in the first few minutes is extremely important in reducing neonatal deaths. The fact that nurses and midwives working in delivery rooms and neonatal intensive care units pass through the Neonatal Resuscitation Program and gain knowledge and experience in this field will be effective in reducing neonatal deaths. This research was applied to all nurses and midwives working in the OBG and maternal clinics of public hospitals in Adana, Turkey, who had received Neonatal Resuscitation Program training. And so there's some different samples. A lot of them took the course within 4 to 5 years. Here in the United States, I have to do it every 2 years and be up to date on that. And I think that actually, at some points, it can kind of be a little frustrating, but if you practice things, it'll become a lot more second nature, and that is the point of it, is being able to do that without really thinking too much about it. All right, so NRP, so does it help? According to this study that, again, is kind of linked below here, NRP is the developed world standard of care to prevent deaths and complications of cerebral palsy due to asphyxia. And when systematically implemented by trained professionals, it has the potential to annually prevent up to, or I don't know where they came up with this number, but 192,000 intrapartum-related neonatal deaths worldwide. So they were looking, I think, kind of as a whole kind of a thing with this paper, and saw that it really was effective that way. All right, so location, I know there's been a lot of talk about home births and things like that, and I'm not trying to say that bad things are going to happen if you do a home birth, or the best outcomes are going to happen in the hospital every single time for every single patient, and kind of vice versa, right? According to this little study that I read, it was from like the OB journals. So again, kind of look at who is putting these papers out and everything like that. But it did come up and say that the safety of birth in the United States varies by location and attendant. So compared with U.S. hospital births attended by a certified nurse or midwife, planned U.S. home births for all types of attendants are a less safe setting of birth. And so they were looking at the death of the neonates and where that took place at and everything. So definitely some kind of heavy stuff there. Again, I just want to encourage everybody that is a healthcare worker that works in hospital setting, really almost anywhere that you're in the ED, ER, or women's health kind of a thing in the hospital, you should be familiar with NRP and the algorithms. So before we get into some specifics, let's talk about what NRP is all about. So the NRP method is an evidence-based program developed by the American Academy of Pediatrics and the American Heart Association to standardize and improve the quality of neonatal resuscitation practices. It provides guidelines and algorithms for healthcare providers to follow when faced with a newborn in need of resuscitation. And I've had to use it multiple times, and it definitely helps when you're in that high-stress situation to be able to be like, hey, this is what I need to focus on, this, and this. And then always practicing those kind of things, practicing your technique of how you take care of these kids. I think it's instrumental for sure. So the first few moments, like we read on one of those papers, of neonatal resuscitation are crucial, okay? According to NRP guidelines, the initial steps include assessing the newborn's condition, drying and warming the baby, and stimulating breathing if necessary. A lot of the time, we really would like to keep these kiddos with mom, and if they're doing well and they don't need any intervention by us, we're going to keep them with mom and get that bonding going as fast as possible. And that's what I feel like has happened a lot of the time with the kiddos that I've been taking care of, is that we really would like them to go with mom and do it safely. So this helps establish effective ventilation and oxygenation, setting the stage for further intervention if we need to. So this is a diagram that came from the American Heart Association, and it's very similar to the ones that we use and everything like that. So if the newborn isn't breathing adequately, the next step is to provide positive, we've got this thing here, and we'll definitely go through it, but it's to provide positive pressure ventilation. This can be done by using what we use a neopuff a lot of the time, with a mask and a neopuff, and just goes onto the baby, their face, and you just kind of give them breaths there. You can do it with an endotracheal tube, which I'll go over here in a little bit, but that's pretty much a tube that goes down through the mouth into the vocal cords, right into where the lungs are, and you're able to breathe for the kid there. So it's essential to ensure proper technique and monitoring to avoid complications and optimize oxygenation. All right, so here we'll kind of go through this a little bit. So again, the kid's born. If they're term, they have good tone, meaning they kind of move around a little bit, and they're crying, they're going to stay with mom. We just kind of make sure that everything's good. 'Cause sometimes they can kind of turn the other way, but a lot of the time they'll just go with mom, do their thing. Don't even have to have any intervention. If they're not having those things, then we bring them over to the warmer. We try to get them to the right temperature, not too hot, not too cold. We're position their airway to make sure that they can breathe on their own. That way we clear any secretions. Birth is kind of a gnarly thing sometimes, so they can get things in there. So you're suctioning things out if you need to, and you're drying them off so that they can get warm. And that also stimulates them to cry and then kind of cough and cry those things out of their lungs that they don't need in there anymore. So if they are still apneic, so not breathing, or they're gasping, which is not effective breathing, or their heart rate is lower, below 100 a minute, then we're going to start using what I call positive pressure ventilation, and we'll use a mask and a neopuff. And we're just trying to give them enough pressure to get their little chest to rise and kind of go back and forth, and hopefully they'll kind of pick up that on their own. We'll put some monitors on them and make sure that they are getting adequate oxygenation. This little chart here, where we're doing by the minutes that they were born and what their SpO2 percentage should be. So kind of cool stuff there. I use this all the time, and if they're a little bit lower at first, it helps you to realize, oh yeah, it's okay. We're not where we need to be at this point. So if their heart rate still is below 100 and they're not, not doing the best, we may have to put that endotracheal tube in, like I said, to be able to breathe for them, and then kind of ventilate them. And if their heart rate is below 60, we'll have to do chest compressions, which involves doing this kind of to the baby, pushing their chest down and letting it recoil, so we're kind of compressing that heart to be able to get cardiac output, and then also ventilating. Now, before you start chest compressions, you definitely need to get an airway established with that endotracheal tube, if possible. And so I keep talking about that, and this is that endotracheal tube right here. It's really tiny. It'll go in there. This is the neopuff that I was talking about. So we got that mask on there, and you just put your thumb over that little hole that's on top, and it gives the breath. And so we have this constant pressure and then another little extra pressure that'll help breathe for that kiddo, give them the oxygen that they need. Again, if they're needing the medication, it's called epinephrine. And then these are the blades that we use to be able to open up the kid's airway and their tongue and get it all out of the way to be able to put that tube in. It's a very delicate and pretty complicated procedure. So in some cases, these got medications, like I said, we got epinephrine, such as epinephrine or volume expanders may be indicated to support circulation and improve outcomes. Advanced interventions like umbilical vein catheters or endotracheal tube intubation right here may also be necessary in certain situations. It's essential to have a thorough understanding of NRP guidelines and protocols to ensure timely and appropriate interventions. You don't want to just do things just because you feel like it. It does need to follow a guideline and standards, and you need to be the one in charge of knowing those type of things. So, in summary, following the NRP guidelines is essential for providing effective and standardized care to neonates or newborns in need of resuscitation. By understanding the principles and algorithms outlined by NRP, healthcare providers can ensure the best possible outcomes for these vulnerable patients. Thanks for joining me today. And remember to stay informed and prepare to handle neonatal resuscitation situations in your area of expertise and work. So if you haven't taken NRP, I would highly encourage you to do it. There's a lot of good information that you can get from it. I also kind of feel that way with ACLS and PALS and Stable. Just a lot of good information that do nothing but help you. And so these principles that are taught will help make you a better doctor if you're doing that, a nurse, and especially a lot better respiratory therapist and being able to do that. So thanks again for spending this 10-minute learning with Brandon, and I hope to have any kind of interaction and fun with you guys. We'll see you later. Okay.